Here is my audience. My name is Kyra Ramos, and I would like to tell you a little bit about a topic that I researched last semester when I was taking OB nursing. So when a woman becomes pregnant, she automatically starts receiving all sorts of advice from doctors, nurses, magazines, friends, family, coworkers. Sometimes it's conflicting and it can be pretty confusing. One of these areas is exercise and what level of activity is appropriate and safe for a pregnant woman to perform. In Western medicine, we like to tell pregnant women, that they shouldn't be lifting anything too heavy to avoid trauma to the fetus and to mom. But more recent research has shown that a reasonable level of strength training can actually contribute to the well-being of a woman during pregnancy. Obviously, there's some limits. We're not going to be setting any personal strength records. But if you were physically fit before pregnancy, there's really no reason you can't enjoy the same level of activity as before you were pregnant. Even if you were never active, it's never too late to reap the benefits of strength training. So weight training can ease discomforts during pregnancy and during delivery. It can increase the basal metabolic rate, and it can help to control blood glucose levels. So remember, we're not going to be going crazy with weight, and strengthening any muscle group can be beneficial, some particular ones more than others. A strong core, such as your abdominals and back, can improve your pain and posture during pregnancy. A strong pelvic floor can help with an easier delivery. And women who are physically fit during pregnancy generally return to their pre-pregnant state quicker to someone who was a little more sedentary. So not only does weight training improve general strength and well-being in pregnancy, it can also raise your metabolism. When you do any strength training, you increase your lean mass or your muscle. You increase your glycogen stores or your stored energy in your skeletal muscle, raising the basal metabolic rate, which are your caloric requirements while the body is at rest. So this allows a woman to eat a little bit more without any worry of excessive weight gain that can lead to gestational diabetes or having a really large baby that's prone to a birth injury. And I've never met a pregnant woman who wouldn't want to eat a little bit more. So not only can weight training kind of help prevent gestational diabetes secondarily by increasing the basal metabolic rate, in women who already have gestational diabetes, there are also some great benefits. Some women are able to control their blood glucose through diet, but some require exogenous or injected insulin. While this does decrease the rate of fetal macrosomia, those big babies that are prone to injury, the insulin is potentially stressful to the unborn fetus, and it does not correct the problem of peripheral insulin resistance, which is one of the more challenging features of diabetes to control. According to a 2003 University of Alberta study, strength training is effective in increasing insulin sensitivity in expectant mothers with gestational diabetes, allowing for better glycemic control. So in short, women who strength train with gestational diabetes can rely a little bit less on the exogenous insulin. So remember, it's not going to be any time for setting any personal strength records. It's important to be cautious, listen to your body. It's very important to listen to your physician if you have a high-risk pregnancy. You don't want to overdo it and injure yourself or the baby. And it's also important to remember that it's not a time to exercise for weight loss. It's simply for building strength to get the benefits from that. Thank you.